Okay, so now I'm going to start an IV and hook up an infusion of fluids. So first things first, I'm going to check and make sure I have the right patient, right dose, right route, right time, right drug, the right documentation. I'm going to check my MAR and make sure that this patient has orders to have an IV placed and fluids ran. I'm going to complete my calculations. This patient is going to have this saline ran in at 28 drips per minute. And so first things first is I'm going to set up my fluid bag. So I have my bag, my pole, my tubing. Open my tubing, close my clamp. Maintain not touching my bag. I'm going to label my tubing when it was started, the date, the time, when it will be completed. I'm going to prime my tubing, fill my chamber halfway, open my clamp, and my fluid to the cap. Reclamp. I'm going to start an IV in my patient. I'm going to ask my patient for 2 identifiers. I'm going to explain to her what the procedure is. So I'm going to wash my hands. I am going to put a pad under her arm in case she bleeds. I'm going to put on a tourniquet. I'm going to look for a vein. I'm going to pop my tourniquet, get all of my supplies together, make sure I have the right size needle, alcohol swabs, gloves, a flush, a lock, wash my hands, put my gloves on. Put my tourniquet back on my patient. Make sure I still feel that same vein. To clean it with an alcohol swab. Take my flush. With my non-dominant hand. To pull the skin tight. Feel my vein. Small poke. Insert. Do not insert my needle anymore. If I see a flash. Insert my catheter. Remove my needle. Hold down the vein. Put my tourniquet. Push. Drop back. I get blood. Push forward. Push fluid. Wonderful. So now catheters in. To secure it, take my tape and make a little hub to keep my catheter in place. Doing okay. My patient is doing okay. I'm going to take my tubing, connect it to my extension. I'm going to start my infusion at 28 drips a minute. to let that infuse. I'm going to place my patient back into a position of comfort. I am going to clean up my area, dispose of everything properly. I am going to document properly in the chart about where and how big her IV is. And then I'm going to continue to check on her.